I will now hand over to Dr. Shradha Lakhani. Thank you.
Thanks, Soraya. So my name is Dr. Shradha Lakhani. I am a consultant clinical psychologist. This is new for me, so in terms of doing it through Zoom, so my anxieties are sky high. If something doesn't work, Soraya, just wave at me and get my attention so that I can call IT Tech Hubby to help me sort it out. But hopefully it should manage because we've trialed it before. So in terms of housekeeping, I think Soraya's covered it all. If you do need to take a break, please turn off your camera if you're joining in via Zoom, just so that we know that you've left. Otherwise, you'll be facing an empty chair. If you do find anything upsetting or distressing, I'm hoping not. I've delivered this quite a few times. There is the support line that's still active. So there's the number again, 0207 923 5475. We've got Val and Rachel, who wave again, please, for me so that people know who you are. There you go. So in terms of just how we're going to do this, if I can suggest, like Soraya said, if I can do the formal presentation and then take the questions at the end, but that doesn't mean to say that you can't submit the questions as I go through, because I appreciate that sometimes questions arise in our mind's eye, and if we hold on to them too much, they may fade. So allow yourselves to keep submitting them. I can see, I have got a separate chat box open as well, so I can see them coming in. But I will address them all at the end if that's okay. So thinking about when I was asked to present this, anxieties and uncertainties, you know, knowing how much our world has changed over the past 5 or 6 weeks, I think it is so apt, isn't it? In terms of anxieties and uncertainties for the whole world right now, knowing how much our worlds have changed, everyone is faced with anxieties and uncertainties. And, you know, I don't know if you were aware or if you may have watched the George Alagaya interview on the BBC, as George Alagaya is a news presenter who's had cancer himself and then had COVID, and he recovered and he came onto the news to be interviewed. And it was so interesting because his opening line was, "This is our world, anxieties and uncertainties." So as much as he struggled with the whole physical aspect of COVID, actually, and this is what I've found with all the patients that I support, anxieties and uncertainties is a part of having had cancer, isn't it? Post the diagnosis. Okay, so is it normal to have anxiety post a cancer diagnosis? You know, if we were here in reality, I'd pose this to you, and having just said I've delivered this quite a few times, I pose this and I say, is there anyone in the room who doesn't suffer from anxiety? And I would say that again, and absolutely, you know, anxiety post-cancer is absolutely natural and normal, because the formal definition of anxiety is that it's a feeling of worry, nervousness, uneasiness about something with an uncertain outcome. So knowing that we've had cancer, it was never in our life plans for most of us, unless it was a genetic risk, in which case it may have been in your periphery, but for majority of the patients, it comes out of the blue. So having had the diagnosis, having had the treatment, whatever the treatments have been, even for patients who've completed treatment, so whether that's 6 months, 6 years, 16 years, 20 years, the uncertain outcome is still there, because majority of the time what patients want to hear is the cured word. And that, you know, nowadays, so for the past, I've been working in this for 2 decades. Initially when I started, the word cured would be used, but it completely went out of fashion because they don't use the word cured. Remission is as best as it gets, which means that you are still under surveillance. So, you know, it's not the word that we like, because often patients want to hear the word cured. So it leaves elements of uncertainty still there, because we are still having routine scans, and because we've had this experience, your mind's eye can't take it for granted anymore. So anxiety is absolutely there, is absolutely normal, it's natural. and thinking about anxiety even prior cancer. Okay, recognizing majority of the world has anxiety right now, even though they don't have a cancer diagnosis. It comes from our caveman days. Okay, prehistorically, if I give you a quick whistle-stop tour of where anxiety comes from our caveman days. Okay, imagine we were living in our caves and we were hunter-gatherers. You had to go out to fight for your food, to get your food. Quick thinking brain goes, right, I'm in danger, because if I step outside of my cave, I will be faced with saber-toothed tiger, with beasts, with dinosaurs. So your body is prepped for either fight, I've got to fight this beast as hard as I can, or run as fast as I can. Both of those, fight or flight, instigate the same physiological response, okay? So your heartbeats 10 to a dozen, you feel sick, sweaty palms, jelly-legged, blurred vision, okay? Just some of the symptoms of anxiety sort of from caveman days. Bring it forward, 2020. We don't have those beasts, we don't have those dinosaurs, saber-toothed tiger, but what we do have still is threats, okay? And cancer becomes one of our threats. So our mind's eye is in a heightened state of alertness post-cancer, because that's become our beast, that's become our threat. So knowing that, you know, we are in 2020, our minds have developed, but if you think about your emotional mind, it's still the same mind from our caveman days, still induces fight or flight. There is a third one, freeze. If we freeze, we dead meat anyway, and that's that paralyzation sometimes that we get as patients, where actually I just can't function because I'm here, but I'm not here, okay? So instigates that fight, flight, or freeze. But, you know, saying that about anxiety, it gets such bad rap, and yet it's our safety mechanism. So having just explained it as, you know, your body sends the message of threat, and your brain sends a message of threat, your body responds. So actually what you see is your mind's eye trying to safeguard you from all of these threats. It's preparing you by giving you this heightened state of alertness to say, actually, there's danger looming and we need to take action. Almost what happens with cancer diagnosis is that if you think about it as a switch, it just flicks on and off too quickly. So you might be driving, going somewhere to see loved ones, or, you know, wherever you're driving, and you might have gone across a billboard, which, you know, say Macmillan, billboard raising awareness, or you may be listening to the radio and a cancer advert comes along, because again, what public health forget to tell Joe Public is that every month is dedicated to certain cancer sites. So almost in the winter months, you hear the cough, cough, and the awareness of lung cancers. So every month is dedicated to certain cancer sites to raise awareness for Joe Public to say, just be aware. So your mind's eye hears this, and almost sets off that anxiety trigger. Almost that quick thinking, brain goes, right, there's a threat. So the anxiety flick switches and we get all of those symptoms. If you take away nothing from today, remember, anxiety is a friend of ours. It's making us aware of what we need to be sort of mindful of in the longer term. And, you know, over time, there is a school of thinking that's just that everything you hear, taste, feel, all your sensory experiences are stored at the back of your head, okay? And knowing that we now have anxiety, associations are created. So this is how we make memories. So often I will hear, and I'm sure our colleagues will have heard as well, patients will say, it was that chair that I sat on when I got diagnosed. So almost anxiety has been associated with that chair in the waiting room. So I can't sit on that chair. It's those clothes that I wore. We create associations with the diagnosis. often we'll hear of patients saying, those are my chemotherapy clothes, those are my radiotherapy, those are my cancer clothes, and I can't wear those. So memories become associated with anxieties, and almost, I can't wear that again because that anxiety will get triggered again. Okay, so you can see how powerful memories become and get associated. So that in itself sets up cycles. We lose confidence, don't we? Okay, post a cancer diagnosis, we become nervous, stressed, worried, bad memories get associated, and that cycle just goes round in circles. Awareness is the first sign of breaking that cycle. Okay, as soon as our awareness raises that I've lost confidence, it's that thing, where do we get confidence from? We can't buy it from Sainsbury's, we can't buy it from Waitrose, we can't buy it from M&S. Confidence comes from our experience, okay? And I'll talk about this later as well. So knowing that we have anxieties from caveman days, is it any wonder that we have uncertainties? Bearing in mind, your mind's eye is trying to protect you, safeguard you from dangers. It's learned about cancer. So again, uncertainties, recurrence fears, I've named it. Okay, is on the horizon. So this is your mind's eye now making you aware that actually, let's be mindful that recurrence fears can arise, that recurrence can happen. So it's just trying to protect you by flagging it up. Okay, and it is very, very natural for all cancer patients. It doesn't matter which cancer site they're from, whether that's ovarian, breast, prostate, recurrence fears are there for all cancer patients. Because we've lost trust in our bodies. We were living in our bodies for decades, depending on how old you are, and we trusted our bodies. And almost we feel let down, okay? So we lose trust in our bodies. We lose trust in the world around us because your mind's eye is desperately trying to make meaning. Why did I get this cancer? Is it the stress? Is it the pesticides? Is it the food that I was eating? Is it my lifestyle? So it's desperately trying to make sense. So, and because there are no definitive answers, we lose trust in ourselves. Okay, and again, I'll come back to that in a minute. Your mind's eye becomes heightened with that anxiety because, again, remember, over decades we've learned to see ourselves in a certain way in a mirror. We know who we are. In our mind's eye, we know who we are physically. Post a cancer diagnosis, post the treatments, we will have changed in terms of our hair might be different. We might have lost our hair. When hair comes back, it may have come back in a different texture. We may have lost weight, we may have gained weight. Again, all of this, when we look in the mirror, it becomes heightened because our mind's eye becomes heightened because I don't recognize the person I am. So naturally, it creates anxieties. Fatigue. Again, if I was in a room with you physically, I'd say, who doesn't struggle from fatigue? And, you know, for people who don't understand fatigue, it goes post-tiredness, doesn't it? The light just switches off. And, you know, some of the ways in which I've had patients describe fatigue is the mind is willing, but the body absolutely says no. Okay, there is just nothing left. So that's that fatigue. And again, I'll come back to that in a moment. We have, over recent times, lots of celebrities raising awareness of cancers by naming their own cancer diagnosis. I've just named George Alagaya, and it's really interesting. You know, we often use TV as a means of escape, but often now what we find is when we switch the TV on, or you'll be flicking through a magazine, your mind's eye seeks out all of those cancer stories. And it's not that you are attracting all of these cancer stories. It's just our mind's eye has developed a cancer antennae that it just does. It just sees it everywhere. Because you know, if I bring it away from cancer, if you think about that one dress you wanted because of that color, or you buy a new car because it's just so different, you buy it, and then what happens? You see 10 of them, okay? So it's just that your mind's eye becomes used to seeing that, so it will notice it, okay? So yeah, it makes it really difficult knowing that wherever you're turning, it's there. Almost our mind's eye is still heightened. It will relax over time. It's just that it is so heightened right now that we're noticing it everywhere. And you know, from a very, very young age, we've been brought up with dates, haven't we? Don't forget your birthday. Don't forget my birthday. Don't forget my anniversary. So we've been shaped to remember dates. So if I said to you, date of diagnosis, date of start of treatment, date of end of treatment, all of these become imprinted in our mind's eye because this is how we've been shaped. Again, if you take away nothing from today, acknowledge those dates to yourself, okay? Some people choose to make a big event out of those dates. So almost, this is my second chance, and they'll throw parties or they'll do something big. What I would say is, if that's not you, at least acknowledge it to yourself. If you don't, your mind's eye will trip you up in the day, whether that's tears streaming or whether we become irritable, just sad, and actually, I don't know what's going on today. I just don't feel like myself. Okay, so please, please acknowledge those dates to yourself. Again, post a cancer diagnosis. If I say pre-cancer, think about all those roles you were playing. You're a mum, you're an employee, you're working, you're doing lots of physical activities, you're a friend, you're a daughter, you have multitude of roles that you had. Cancer comes along and almost all those roles become redundant, don't they? And we take up that cancer patient role. Okay, post treatment, what I would really encourage is let's pick up some of the other roles that are so much more meaningful, so that cancer and being a patient doesn't become the only role. It becomes one of the smaller roles that we still need to play when we have appointments. But otherwise, pick up the role of wife, pick up the role of being daughter, pick up the role of being a mum. Pick up some of those roles that you choose to pick up. Something else that makes our minds very heightened is those appointments. Okay, so you will know whether it's that brown envelope, whether it's that white envelope, depending on the hospital that's tracking you. If that envelope already falls on the floor, we get that anxiety, okay? And it's interesting, isn't it? It's a double-edged sword. So as much as we don't want appointments, if we don't have those appointments, then we become anxious. It really is that double-edged sword to say, nobody's following me up. And it becomes that thing, doesn't it? You know, as much as we never wanted to have treatment, we get used to having those treatments. And when we start our treatments, depending on how long they've become, habits form so quickly that when we come to the end of treatment and they say, you have no more treatment, actually, that's my safety net. I still want to see you. I want more scans. At the beginning, you start with, I am sick of hospitals. And then we come to that place of, I want more hospital appointments. So it really, remember, your mind's eye will argue with you regardless. Okay? It's what it's shaped to do. Whatever you say, it will argue with you. Give you an example, away from cancer. If I say apple, what did your mind's eye say? Possibly pears, oranges, something different. It will always, always flag up the alternative. Your mind's eye is not made to agree with you. Okay, so recognize that you're not alone in this. This is what our mind's eyes are made to do. Again, they argue with you because it's a part of the anxiety cycle to make you aware of what you might be missing. It's just what your mind's eyes shaped to do, to flag up the alternative, to say, don't forget, okay? So we really, really need to learn to live with these uncertainties that we're faced with. So your mind's eye, again, like I mentioned, is desperately trying to make meaning. Why me? Okay. Often hear this from patients. And you know that why me? There is no definitive answer to that why me. Then, you know, as much as research has come so far forward, there is no definitive cause equals cure. If we knew a cause, we'd be closer to a cure. There are things that can make you more susceptible to cancers, i.e. Diet, weight, alcohol intake, but there are no definitives. And again, this creates that unjustness, because you will know people in the world who will have the most unhealthiest of lifestyles who don't have cancer. Okay, so instead of investing all of that energy into the why me, I would say take control of it and say, how do I move forwards with this now? Okay, in terms of taking up some of that well-being, in terms of looking after yourself. So, you know, let's not go crazy with the physical activities or the diet, but let's just think about taking some of that control. And again, I'll come back to physical activities and diet in a moment. Ooh, wrong way. So we are desperately trying to take control. And in taking control, again, recognize the world that we're living in. If I just take you out of this cancer bubble for a second, bring you back to the real world, where the whole world is struggling with uncertainties, desperately trying to take control. What the whole COVID situation has created is an existential crisis, hasn't it? Because people are becoming aware of how they want to choose to live their lives or not live their lives. And you know, for us as cancer patients, once you've had cancer, almost we get these cancer tinted lenses where we are choosing what we want to focus on and what we don't, because you've lived with that existential crisis already as soon as you had the diagnosis. Because as much as you don't want to think about it, what happens in the millisecond of diagnosis is your mind's eye goes to that death thinking, and in that millisecond we've already planned our funerals, okay, before we get jolted into these are the treatments, this is what we can do. So almost it's that existential crisis that creates that anxiety too. But you know, we've been living with this existential crisis all our lives. So if I said to you, what's the meaning of a birthday? Okay, often I'll have patients saying, it's a day of celebration, it's a day of rejoicing, partying, doing whatever. And you know, there's a really morbid way of looking at it. It's a year closer to death, isn't it? Okay, knowing that I teach this, knowing that I say this, I can't bring myself to say, kids, I'm dying daily, you're dying daily, and I'll see you later. It just makes a mockery out of life. So what, as human beings, we can't do living and dying together. So we flip it onto its head and we say we're doing the living. Okay, and post a cancer diagnosis, it's that we keep being pulled to between the living and the thinking about the planning for the dying. We can't do it, okay? But this is to say, it's nothing new. We've been living alongside this all our lives. We've just chosen to focus on doing the living. And that's where we need to get to again. So it's that existential question. The whole world, even your loved ones, are finding this now in terms of finding meaning of life, because with this whole COVID situation, people are deciding what they want to do post the whole lockdown and how they want to live life, because they've now realized that actually, hopefully, what matters is relationships. You've already realized this post your diagnosis. It almost feels like loved ones now have a window into the world of cancer patients, because this is how we've been living. We do have those cancer tinted lenses where post a diagnosis, we're not bothered about whether the bins are put up put out or not. We're not getting cross with our loved ones about that. It's just a minuscule thing. We're not bothered about having arguments about people jumping queues or whatever, because you've noticed there's a bigger picture in life. So we do need to retake doing the living, and a part of doing the living is planning for the future. Okay, and in planning for the future, this is where, again, remember, the world out there is struggling because they can't plan for the future, which is why everyone's so keen to know about when this lockdown will lift, because we need hope. In planning for the future, that's what it gives us. It gives us hope. Post a cancer diagnosis, I hear a lot of patients saying, I can't go too far. I don't want to go abroad for holidays when we could go abroad for holidays, or I don't want to go too far away from home because I've lost my confidence. I need to be around the hospital just in case. So we either become stuck, completely stuck in terms of not moving forwards, or I've had patients who become hyper alive. So they'll be booking when they could their 5th and 6th holiday abroad. Okay, we can't manage that level of being alive either. We need to find that in between again, from being stuck to being hyper alive, and being, you know, just how you need to be in the middle, taking each day as it comes. And it's that impact on our loved ones as well, because that becomes that double-edged sword. As much as they were concerned about you when you had the diagnosis, almost they may become overprotective now and want to take away all your roles. So don't do the vacuuming, don't do the cleaning, don't go to work. You know, I would say take back some of those roles. If you choose to, if you want to give up the vacuuming, give it up, don't do that again. But almost in that, deciding which roles you pick up, once you pick those up, they might go the other way as well. You'll find now. And again, for us, it's that double-edged sword, isn't it? Post a cancer diagnosis, I want to be fine. I want to be normal. I don't want people asking me about cancer all the time. And yet, when they ask, I don't want them to remind me. So it's, again, a real double-edged sword. There's no rights or wrongs. It's just how we feel in that moment. Okay. And all of this because we live with these taken for granted rules, you know, and I often think about this because out there, if you're not healthy and you're not happy, then you're not normal, is the rules that we live by. Because now that you've got a cancer diagnosis, we almost say, but I'm not normal because I'm not thinking like others. I'd question that. And that thing about being happy, knowing that we have the same emotional brain from caveman days that I spoke about earlier. Our default is not happy. Our default is anxiety, because our mind's eye's got to watch out for threats all the time. If happiness comes, great, but over time what happens is we expect that happiness all the time. Our default is not happiness. Our default is anxiety, which is why we worry about worrying and not having anything to worry about. Okay, so we need to almost refine ourselves in terms of how we want to be, and question that I'm not healthy and I'm not happy, so I'm not normal. Knowing that the single most remarkable fact about human existence is how hard it is for humans to be happy, because the goalpost keeps shifting. Okay, so I'll again give you an example in a minute. So we like this because of our culture, aren't we? From a very young age, if you think about when your kids were little, or you see little kids go to nursery, make friends, you'll be happy. As they grow slightly older, pass your exams, you'll be happy. Do your GCSEs, get good grades, you'll be happy. Go to university, you'll be happy. Get a good job, get a promotion, you'll be happy. Get married, you'll be happy. Buy a new house, you'll be happy. Have kids, you'll be happy. Do you see how the goalposts keep shifting? Okay, because we are constantly striving for those ideals. And you know, if I can say anything, happiness has to be a direction that we headed in. Okay, so imagine we headed west. There's not an end point. Let's just move forward, headed in that direction. And in between, as we head west towards our happiness, you might have goals. So I might want to see that mountain, I might want to achieve something, I might want to go to that beach, that museum, whatever it is. These are our goals. But once you've achieved that goal, it doesn't mean that happiness stops, because we're still headed in that direction. Again, we like this because we've been brought up with rules. Our mind's eyes have been shaped with rules from when we are so young that we take them so for granted now. So don't touch the radiator, you'll get burnt. Don't talk to strangers, it's dangerous. Don't eat things off the floor, you'll get germs. Don't cross the road without looking both ways, you'll get hurt. Now, having had this cancer experience, our mind's eye doesn't have a rule, so it will create a rule. Don't forget you've had cancer, you'll get recurrence. It's not a definitive rule, but because your mind's eye has not been here and it's shaped with having rules, it's created a rule. Okay, let's just become aware of that. Again, we like this because our mind's eyes are shaped to problem solve. So it's anticipating problems before they've even arrived. Hence, we worry and use worry as a coping strategy. We worry about not having worries, okay? And you will know people like this. So again, let's ease into this a little. And that whole thing sets up its own cycle. So the trigger might be the cancer thought, which creates fear. Don't want to have that again, which creates stress. And we start worrying about it, which creates its own, I shouldn't be thinking like this. I shouldn't be thinking, I should be thinking positive. We put more pressure on ourselves. And if I don't think positive, I'm stressed. And if I'm stressed, then I'm more likely to get cancer. And there goes the cycle again. Okay, can we stop battling with our thoughts? And again, it's always in the still of the night that the thoughts catch up. Okay, so thoughts will always flood you with the most worrying possibilities that you cannot do anything about in the still of the night. So again, giving you quick tips, keep a notebook by your bedside. And if you can, thought dump, just write down all your worries, not for you to problem solve before you go to bed. Just close the notebook so that almost your thoughts feel like they're held. Or create that worry time slightly earlier in the day. Sounds like psychobabble, but it actually works. If you say between 4 and 4:15, I'll just write down all my notes, all my worries, thought dump it, not for you to reread it. And I always encourage patients not to reread what they've written because that induces post-trauma. Don't reread it, just write it and close the book. Or write it, cut it up into little pieces and flush it. Okay, so it's gone away. Other ways of managing with sleep, because I appreciate a lot of patients will say sleep is really difficult. You know, there's this thing called square breathing or rectangle breathing. We've got squares and rectangles everywhere in the world, okay? Whether that's me staring at a screen right now or whether at nighttime you've got a window or a door, just breathe in for 4, out for 4, in for 4, out for 4. If that doesn't work, and again, allow yourself just to say, I'm resting. I'm not counting down how many hours I've not slept for or how many hours I've got left. Turn the clock away because we don't need a clock. We've got a body clock that often works. If you need to set an alarm, fine. Turn the clock away because otherwise you will count down. If you can, just allow your mind's eye to say, I'm relaxing. If sleep comes, great. If it doesn't, I'm rested. In doing that square breathing that I just described, in for 4, out for 4, if that doesn't engage your mind, use colors. So breathe in some colors that you like, breathe out colors that we struggle with. Again, just different ways of engaging our mind's eye. Again, we get so caught up with sleep and how many hours we've not slept for, it creates its own cycles. So when we're tired and we haven't had enough sleep, then I'm worried about how tired I'm going to get and I won't be able to do everything I should do, could do, ought to do. So I feel worse, and then I don't feel like eating, and it sets up its own cycles. And what's the worst that happens with sleep? If you haven't had a good sleep, what's the worst that happens? You're tired, but you function. You might have a nap. You know, it's okay. You will still manage. Okay, so let's not get caught up too much with sleep. Again, we are like this because we've got that problem-solving mind, because your mind's eye is constantly trying to find meaning with everything. So we start battling with our own thoughts, and we become trapped in our thoughts because our thoughts start arguing with themselves. Please, can we recognize thoughts are just thoughts? They're just random synapses that are firing off all the time. I want to play you a YouTube clip, which is fantastic, I think. But if I just explain it in terms of explaining thoughts are just thoughts. So in this metaphor, thoughts are passengers that arrive on a bus. We can't control for who arrives on the bus, but what you can control for is how you direct that bus and where you want that bus to go. So the point being, we can choose our route. We don't get to choose the passengers, because your mind's eye will forever, if those passengers are your thoughts, they will forever argue with you. Okay, whatever you do, it will be chattering away. It's almost like those chimps in your head that just keep chattering away. We need to focus on where we headed, because those thoughts are not real. An analogy, if I give you, would you ever get on a train or a bus if you didn't know where it was headed? Okay, often we'd say no, because it would be dangerous. You wouldn't know where it was going. But again, in the still of the night, we get trains of thoughts going by that hook you with images of cancer, images of loved ones, images of what's important to you. And what we often do is jump on board, and then curiosity kicks in. And almost, I don't want to go down this road, but I can't get off again. So what I suggest is, can we get off that train of thought and just allow ourselves to observe that train? Don't battle with it. Pushing those thoughts away doesn't work, okay? Because you're still attached to them. You're arguing with them. Arguing with our thoughts never works, because they will tie you up in knots. We've always had thoughts, but we've been able to dumb them down, okay? Because we've focused on where we want to be headed. And that's what we want to do. Keep focused on where we want to go. Another analogy is if we can think about thoughts almost as a carousel, okay? Where when you go on holiday and you've got lots and lots of bags that go round and round. Almost now what we've got is that bright red bag of cancer, and we desperately unpacking it, saying, don't want to think it, don't want to think it, I really don't want to think cancer. But in unpacking it, you're already thinking it. So can we allow ourselves to just observe those bags? They'll come around, that cancer bag might fall off, it might jump on board at other times. Rather than become that thought, let's just allow ourselves to learn to observe that thought. Okay, so it's not what shows up. It's not that our thoughts that show up that makes it difficult. It's what we do next with it, because we start battling with these thoughts. We try to fix them. We start arguing in our mind's eye, desperately try to push them away, try not to think about them. As soon as we start battling with our thoughts, they become bigger. Okay, giving you this image, I'd say, what is this image? It's an image of a man sinking in quicksand. What should you do in quicksand? Stay still. Okay, so can we just stay still with our thoughts and not battle with them? You know, the RNLI last year created this video that I'll play you next. It's only 30 seconds, but again, I love it because it so makes the point in terms of what you should do when you, if ever you fall into cold water. Let me play you this, because again, it makes a really good analogy.
Everyone who falls into cold water unexpectedly has the same instinct. To swim hard. To fight the cold water. But when people fight it, chances are they lose. Cold water shock makes them gasp uncontrollably and breathe in water. Then they drown. But if they just float until the cold water shock has passed, they'll be able to control their breathing and have a far better chance of staying alive.
Again, I think it makes such a good analogy. Okay, can we not battle with our thoughts? When we start battling with them, it goes against our instinct, I know. We start drowning in our thoughts. We become paralyzed by them. Can we learn almost to surf that wave? Okay, when those waves come, let's just ride those waves, but almost let's just observe them rather than become them. Okay. So it's when we push against our experiences, we start getting trapped in the what ifs. What if this happens? What if the other happens? And it's always the worst case scenario that keeps you trapped. It's when we start avoiding things and we don't do things that are meaningful to us that we become trapped. When we argue with our own thoughts, and you know, your mind's eye will forever either go to history, because that's all it knows in terms of what's happened to you. Your mind's eye only knows your experience of history, and it will forever review your history with a negative lens. Never gives you a pat on the back to say, well done for that. It always negates everything you do. And if it thinks about the future, it's that uncertainty. Again, it creates anxiety. So you can't control the future because it's not happened, and the past is gone. All you've got is this present moment awareness. Okay, and this is where the mindfulness talk. So I will talk to you a little bit about that later, but it's not trying to hook into your long-standing rules and stories about who you are, who you should be, who you ought to be. It's when we get stuck with our thoughts about the past and worries about the future that we become paralyzed in the present. That's not what we want. Can we shake ourselves off from the past and the future and say, in this moment, this is what I choose to do? So I hope that explains it in terms of developing some psychological flexibility, because otherwise we become trapped. We never ever move forwards towards what's important to us. So as much as I often have patients saying, you know, I want to make the most out of life because of this cancer diagnosis, but I can't go away. It keeps us trapped. Okay, so we need to move forwards towards what we really want to do. So it's knowing that life will throw up thoughts and feelings that will argue with us. Thoughts and feelings in themselves are not harmful. Okay, we will have that natural urge to start arguing with our own thoughts, and it's that causes distress. If we keep focused on where we want to head in life, it makes it easier. So the goal is not to reduce the thoughts and the feelings, but it's enabling you to do the things that matter to you in the presence of these thoughts and feelings. Okay. So almost, you know, battling with our thoughts gives us that image that we're in control. And I would really question that. So, you know, if I give you another analogy, if you were holding down your thoughts, say your thoughts are a ball in water, and you pressing it down, and momentarily you take your eye off the ball or your hand off the ball, what happens to that ball in water? Smack in your face. It catches up. Okay, so we can't suppress our thoughts. It's no use trying to battle with our thoughts. Don't try and fix them. Don't try and avoid them. Don't try and argue with them. Okay, another example. So if I say to you, don't think of a pink elephant. Nowhere in the world will you see a pink elephant. That would just be a silly thing to think of a pink elephant. It doesn't exist. What does your mind's eye do? Thinks of a pink elephant. So the more you say to your mind's eye, don't do it, don't do it, don't do it, the more it will do it. So don't think cancer, don't think cancer, don't think recurrent spheres. The more it does it. If we allow our mind's eye just to be, it may take our attention, but actually it will just evaporate, and something else may take your attention then, because you free yourself up. It's when we become so rigid, and I can't think it, I have to be positive all the time. It's not possible. Okay, so the impression of being given control, it's not true. So let's not try and suppress our thoughts. Let's not try and argue with our thoughts. It's not the problem that is a problem. It's not recurrence. That's the problem. It's how we deal with it. It's not uncertainties. That's a problem. It's how we deal with it. Can we relax into this, knowing that you've got a good team around you that will support you with wherever life may take us? Okay. So it's a solution that we apply in not engaging in the here and now in terms of things that we value that keeps us stuck. So we need to pick life back up to move forwards. We need to regain our values to what matters most to us. Again, another analogy, if we feel like cancer is chasing us, you're constantly looking back for that zombie. Your focus is in the past, it's not in the here and now. If your attention almost is in that rear view mirror because you're constantly looking back because of the cancer, we're not focusing on where we headed. In moving forwards, don't try and move too far into the future, because that in itself will create anxieties because we don't know the future. Your mind only knows the past. So bring yourself to this moment, in the here, in the now, present moment awareness. And if you're investing all your energies in getting there, away from cancer, because I need to reach that milestone, 5 years, 10 years, whatever it is, what are you missing in between? What are you not noticing? So mindfulness, often we think of sitting in a Zen-like state. It doesn't have to be. Okay, we can use our 5 senses. So what can you really see? What can you really hear? What can you taste? And we can use mindfulness in that sense. Think about using other strategies as well, including distraction, relaxation. That can help you cope in the here and now. How we manage with fatigue, it's choosing what you want to do rather than what you need to do. So if you want to spend time having a coffee with a loved one, do that instead of needing to do the household chores. If you can, do it in bite-sized chunks so that you're pacing throughout the day. Okay, do a little bit, stop, have something to eat or drink, and then restart again, do a little bit more. Think about taking control of the diet and the physical activities that I spoke about. So that doesn't mean to say that you go on a cancer diet, because there is no such thing as a cancer diet. It's just healthy eating. Okay, think about the physical activities in terms of just being a little bit more active. Think about planning for your future. I know it's difficult in this current climate, but again, even if it is, future doesn't have to be, you know, when we can go abroad again. Future can be later today. Let me see if I can make that call to that friend that I've been thinking about. You know, the last point, sexual relationships. It often doesn't get talked about, okay? Knowing that cancer impacts on our identity, sexual roles have often been quite crucial for couples, regardless of what sort of couple makeup that might be. If it's an issue for you, please let one of us know so that we can put you in the right, in touch with the right people who can help, because often you will have sexual health counselors as well who can help. Okay. Wanted to flag up this circles of control, because often what we think is that we can influence and control for everything. Absolutely not. The circle in the middle is who you are. You can only control for you. Things outside of you is stuff that you can influence. So we can only but put healthy meals out on the table. We can only suggest, let's go for a walk with our children or teens, knowing that they will make their choices. We can't make them do anything. The outer circle, the very outer one, is often stuff that engages your mind, but often things that you cannot control for at all, including recurrence. The only way you can deal with that recurrence fear or that uncertainty is, again, bringing it back to yourself and choosing to live a healthier life. That's, and attending for your appointments. That's as much as you can do. Okay. Again, just the last slide in terms of asking about questions that might help you make this differentiation between what's helpful and not. With thoughts, is this thought helpful in any way? Is it an old story? Have I heard this one before? Most probably. What would you get from buying into this story? Often very little, because it will be your mind's eye just babbling on. Does this thought help you to take effective action? If it does, great. Often it will keep you trapped. Are you going to trust your mind or your experience? I would say go with the experience. Apologies, I think I've run a little bit over. So if I can open it up for questions. Let me close this, and I should be able to see you all.
So we've had some questions pre-submitted, and we will be taking in any of the new questions as well. So just to get us started, I will ask Shradha one of the pre-submitted questions. So for women with ovarian cancer in the high risk group, it is becoming likely or is already happening that people need to shield before the vaccine is found. So based on what oncologists are telling their patients. So is there any advice on strategies on how to cope with that in particular? Over to you, Shradha.
You know, again, it's such a tricky world, isn't it? So I appreciate a lot of cancer patients will have to shield for your own good, because we can't be affording for your immune system to be going down now. So it is anxiety provoking. Again, remember, your mind's eye will either forecast into the future and make you really panicked, or it will be stuck in the past in terms of having had the cancer diagnosis. If you've been told to shield, please shield, knowing that the health professionals haven't forgotten about you, knowing that you've still got access to the phones. Okay, so please call your nurse specialist if you're worried about anything. Other than that, you know, you need to shield. And I know in terms of my work at Warsaw, we are opening services back up. So, and I think it's been in the media again as well, that they will be opening services back up for cancer patients. It will be different in different areas, but it is coming. You've not been forgotten about. Okay. And please don't forget to utilize your nurse specialists. They are still there. They may not answer the phone instantly, but they are there. They may be out and about on wards, but they are there. Each NHS trust, if you're in the NHS, will have access to a lead cancer nurse who will be directing services. I don't know the names of all the lead cancer nurse specialists, but I know the one for Warsaw, and she works very closely with me. Again, there will be a lead, so ask for the lead cancer nurse if you don't get in touch with your own nurse specialist. I hope that helps to answer the question, unless I've gone off track.
I think that was a good response. Perfect. I'll move on to the next one. So a couple of people have asked how to cope with appointments and treatments being cancelled and not knowing what's going on inside their body.
You know, it comes back to that lack of trust in our own bodies, doesn't it? Okay. Despite how many scans you've given and blood tests you've given, and I know we want scans and blood tests because they give us an insight into our intricate selves, only you know how you feel. If something doesn't feel right, pick the phone up to your nurse specialist. But we do need to learn to trust our own bodies again. Okay, and this is a part of moving away from the cancer realm, isn't it, and goes into survivorship. So often when I do survivorship courses, I often say we need to regain trust in our old selves. So think about when you've got a new ache or a pain, because often when you get a new ache or a pain, the instant thought is, it's the cancer again. Okay, can we give ourselves 7 to 10 days to really think it through, to say, have I pulled a muscle? Is this something new because of the activity that I might have done? Again, if it feels too uncomfortable, pick the phone up to your nurse specialist. I've been working alongside our nurse specialists for 2 decades, okay? So I know, hand on heart, I would be able to say for the majority of the nurse specialists, they would say it's easier for us to reassure you on the phone over a phone call conversation that might take 5 minutes than you struggle at home and spiral in that anxiety circle. Okay, but we do need to learn to trust our bodies again. So give yourself 7 to 10 days if you can to see if it settles, knowing that this is what you would have done pre-cancer. How quickly would you have approached your GP or a professional? Often I'll have patients saying that you would have stayed with it for about 7 to 10 days. If it changes dramatically before then, please pick the phone up.
Lovely. I can see that we've had a question. Oh, we've got 2 questions submitted, so I'll go with the first one. What part does acceptance play in coping with uncertainty?
Oh, it's such a tough one, isn't it? Do you know, I don't know how I feel about the word acceptance, because almost it implies that we need to be really okay with it and we can absorb it. Do you know, I would say instead of acceptance, I prefer the word present moment awareness. In the here, in the now, this is the best I can do. So rather than accept the cancer diagnosis, rather than accept the treatment, this is the best I can do in this present moment. Language is so tricky, isn't it? In cancer, we have language of battling. I need to battle with the cancer. I need to accept the cancer. I need to struggle. I need to be a survivor. It works for some people. It doesn't for all. So again, acceptance is one of those words. I would say it depends on how you construe it. Uncertainty is a tough one, which is why I say bring yourself right back. Present moment awareness. This is the best we can do. Okay. I hope that helps.
Lovely. I've just noticed a comment that has come through from Mary about nurse specialists. And I would say that we can push our support line in this instance and just say that our nurses have experience of being clinical nurse specialists themselves, and they are desperate to speak to you on the phone. So if you do have any concerns or any questions, not just now, throughout the year, they are always available. So I'll put the number on the group again, but just so you know that they are a very good option if you need to speak to someone. Okay, and to move on to another question. Someone has said that the time they struggled most was after treatment had ended, and that they felt that they should be elated, but were finding it actually still quite hard, and wanted to know if other people felt like that and if that was a common response.
Absolutely. Do you know, for most cancer patients, having been through treatment, the fireworks don't go off, do they? Is there anyone who felt elated? It doesn't happen, okay? Because recognize, you know, you've been through so much, and often this is the argument you'll have from loved ones saying, you should be over the moon now. It doesn't happen, because how can you be? Remember, your mind's eye now knows that anxiety. You are still filled with those recurrent fears, with those being aware of what your tests are doing, the CA1 to 5 levels, and you know, the scans, and your head is still full of everything. How can you take away this experience that we get elated about it? The fireworks don't go off, because this is a long journey of regaining trust in yourself. And you know, I would always say only other cancer patients will understand that. Okay, so here you will know from your own sort of supports of other cancer patients, regardless of whichever cancer site, they will know what you mean when you say the fireworks don't go off. I'm hoping that the current world in terms of COVID will allow loved ones and Joe public out there into an insight of how can you pick up normality now? Even if they said they can bring, you know, normality back. I'd like to see how many people actually pick up normality of old. We can't, because as much as we want normality, it's changed, hasn't it? Fireworks don't go off. You're not alone in this.
Thanks, Shradha. If anyone's got any more questions, please keep sending them in. Another one that we had pre-submitted was how to stop obsessions of thoughts of death when dealing with terminal cancer, especially when it's harder to be distracted in this time of isolation.
Yeah. Do you know, it is. Thoughts are so difficult. Thoughts are random synapses will be doing this. And remember, your thoughts will only ever take you to the darkest of scenarios. Okay, working with palliative patients as well, I will say, do the work with palliative professionals. So, you know, I'm happy to go here for the rest of you if you feel okay hearing this. Take control as best as you can. Plan for the future as much as you can. If your thoughts are going to things like memory boxes, to advanced care planning type of thoughts, making wills, do that, but then bring yourself, so do the practicalities of doing that thinking, and then bring yourself back to doing the living. And, you know, I work in Warsaw, and I work with the inpatient staff there as well, because we're closely associated with St. Giles. And we have a day hospice as well, where we often refer patients to just come for the day. And often I'll have patients saying, you can't go to day hospice because it's a waiting room to terminal cancer. And, you know, our nurse manager, Tracy, has a fantastic saying: you are alive until you have taken the last breath. Okay, so every moment of breathing, we are doing the living. It is difficult because terminal diagnosis is difficult to come to terms with. Okay, and again, it's an acceptance thing. It's not accepting, we're doing the living, because regardless of however many weeks, months, years they give you, nobody has that crystal ball. Okay, and there's a lot to be said for the fighting spirit. Yeah, I hope that helps.
Thank you. I think we'll just do one more question before we wrap up. So someone's just said that they always feel really anxious in the weeks leading up to appointments or waiting for test results. And is there any way that they can manage this anxiety?
Yeah. You know, there's that term scanxiety, okay? And it's that appointments thing as well, okay? It is difficult. How can you not be anxious about any of those? Remember, for me, not having had a cancer diagnosis, dentist appointments, I hate them. One way of keeping yourself very grounded with all of this, again, thinking about mindfulness, I'm not asking you to sit in a Zen-like state. Use all your senses. In that instance, just become very aware of what you see and study it, and really notice something in the room and absorb yourself in really noticing it. Listen to something and really, really hear it, okay? When you're waiting in that waiting room, feel the texture of the chair. Does it feel coarse? Does it feel smooth? Does it feel warm? Does it feel cold? Really engage all your senses to bring yourself, to ground yourself in that moment, to manage with that anxiety, because all anxiety is doing is either making you more anxious because of having sat in that chair before and having received bad news, or forecasting the future to be told more bad news. We don't know until we're there. So bring yourself, ground yourself in this moment right now.
Wonderful. Thank you, Shradha. Can I just ask if you could sort of maybe mention the main takeaways that you would like women to take with them after today's session?
Oh gosh, do you know, this is where technology, I've gone, my brain's frozen. What you would take away: you're not alone. Look around you right now. Okay, there's lots of people here. You are not alone in your anxiety. You're not alone in this cancer realm. There's lots of you here. If I widen up that anxiety, look around you in the world. Everyone's got anxiety. Everyone's struggling. Don't put lots and lots of pressure on yourself in terms of being positive. Do you know what I would like to end with? If you haven't watched that film, Inside Out, it's a kid's film. Can I please recommend it? Okay. Knowing that you've got psychologists behind there, knowing that you've got all the emotions have a place. The only ones I've missed out of that film is shame and guilt are the two emotions I've missed out. Otherwise, every single emotion has a place. Allow yourself to feel it, acknowledge it, don't drown in it. Focus and take control of your behavior and move forwards in what matters to you. Don't allow the thoughts to overcome you.
Wonderful. Thank you so much, Shradha.
My
I
pleasure.
hope everyone can agree that that was a wonderful session, and we are very grateful for you supporting
Oh.
us with this. And to all of you that have joined, just a massive thank you for joining Target Ovarian Cancer's first online seminar. I hope there weren't too many issues with the technology, and I hope you've enjoyed it and that it's been beneficial. And just a final reminder that our support line is available if you'd like to talk to one of our nurses about any questions or concerns you have at this time, anything that this seminar has sort of brought up to your mind. So if you'd like to just have a chat, please do contact our support line. So again, the number is 020 7923 5475, and they'll be happy to take your calls.